So today I have a sponge that you would use to wash your car and a bucket. I'm going to explain what orthopedic surgeons need to get across to you before you have your total knee replacement and what to expect. Hey, good afternoon. So this is Dr. Gina and I'm with you today. I've got a sponge that you would use to wash your car with. I wanted to talk about what it's like from the perspective of a physical therapist who's had a total knee replacement and what to expect, what your knee is going to feel like after the surgery. So why I have a sponge, I decided that surgeons really don't convey to you what your knee is going to feel like after the operation. This is problematic because the #1 predictor of how you're going to do after your surgery is that you expect to get better. But what I've realized is that people after their surgery, they're hit with so many things at once. And I think the message that gets dropped is what your knee is going to feel like after the surgery. I've got the sponge. You see, it's a dry sponge. We can say that this is like what your knee is like before the surgery. Essentially, you know, this thing is so light that I really don't have to think about it when I move or when I move it, because your brain can pretty much ignore it. Then if I take the sponge, if I dunk it in water, you know, like I'm washing a car, then what happens? All of a sudden, you've got something that's really heavy and it's full of fluid. So this is your knee after your surgery, all right? This is going to be your knee full of blood and other fluid that is going to help your knee heal. But the difference between your knee before surgery is all of a sudden, this is, you know, I have to hold this with 2 hands. It's heavy. All this fluid is going to be in your knee. It's going to make it heavier. The fluid, it's going to restrict your motion. It's going to be harder to bend it. It's going to be a little bit more difficult to move it. I'm not saying, you know, it's heavy like a bowling ball, but it's heavy like a sponge full of water. All of a sudden, your brain, which could ignore like the weight of your knee because it's used to what your knee feels like, all of a sudden it's dealing with, you know, something that's new and novel and, you know, a little bit heavier. Over time, when you ice, you're going to ice and elevate and you're going to get up and move. And what happens with that movement is it starts to squeeze that moisture out of the sponge, which is your new knee. We're not talking days that this process is going to happen. We're talking this is going to be weeks and even months. This is all normal. I wanted to let you know the dry sponge is this is your knee, and then the wet sponge is this is your new knee after a total joint replacement. It's going to slow you down a little bit. It's going to be, your brain will figure it out. Over time, when you follow your surgeon's suggestions or recommendations for icing and elevating, you listen to your physical therapist and you get up and move, that's going to start to get that fluid out. Your brain will get used to this. It will get better over time. So, cut.